Imagine your body suddenly losing control over its own blood clotting. One moment, it's forming too many clots, blocking blood flow to vital organs like your brain or kidneys. Then, without warning, it flips to the opposite extreme. Now you're bleeding uncontrollably, and your body doesn't have the tools to stop it. This is what happens with a serious condition called DIC, or disseminated intravascular coagulation. It's not a disease itself, but a dangerous complication that strikes when your body is already fighting something severe, like an infection or trauma. And here's the real kicker: DIC can happen fast, and if left untreated, it can be deadly. So how do you spot it? How do you treat it? And most importantly, why does it happen in the first place? Today, we're going to break it all down in simple terms, no medical jargon overload. We'll walk you through the stages of DIC, what symptoms to look out for, and how doctors try to stay one step ahead of this life-threatening condition. Part 1. How DIC hijacks your body's clotting system. To understand DIC, let's start with how your body normally works. When you get a cut, your body sends platelets, specialized blood cells, and proteins called coagulation factors to the injury site. These form a clot that stops the bleeding. Think of it like putting a bandage over a leak. But with DIC, that process goes haywire. Imagine your body is building bandages all over your blood vessels, even though there's no injury. These unnecessary clots can block blood flow to critical organs: your heart, brain, kidneys, you name it. It's like your body is trying to fix leaks that don't exist, and it's draining all its resources in the process. This is just the first stage. As DIC progresses, it gets even scarier. All those clots use up the platelets and proteins your body needs for normal clotting. So now, if you get a real cut or injury, you've got nothing left to stop the bleeding. This is why DIC leads to both overclotting and uncontrolled bleeding. Part 2. What triggers this chain reaction? You might wonder, what sets this off? Why would your body suddenly lose control like this? Here's the thing: DIC doesn't just happen out of the blue. It's always triggered by something serious, something that causes widespread inflammation in the body. The most common culprit? Sepsis. Sepsis is your body's overwhelming response to an infection, and about 35% of people with sepsis also develop DIC. But sepsis isn't the only trigger. DIC can also result from major organ damage, like from a severe injury or major surgery. Pregnancy complications, such as a placental abruption, where the placenta separates from the uterus. Blood transfusions gone wrong. Toxins like snake venom. Even cancer. All of these conditions throw your body into a state of emergency, pushing it to overreact and setting off this dangerous chain of events. Part 3. Recognizing the signs. Is it clotting or bleeding? DIC symptoms depend on which stage you're in, clotting or bleeding. But here's the tricky part: the symptoms can overlap, and they don't always scream DIC right away. If your body is stuck in the clotting stage, you might experience things like chest pain, as if a blood clot is blocking an artery. Pain, warmth, or swelling in the legs, a sign of deep vein thrombosis. A sudden headache or difficulty speaking, potentially from a clot in the brain. Now, once your body runs out of platelets and clotting factors, the bleeding kicks in. And it's not just the obvious kind. You might see unusual bruising, small dots, or larger patches of purple under the skin. Blood in your urine or stool. Bleeding from your gums, mouth, or even the vagina or rectum. Bleeding from any wound site that just won't stop. If you experience any of these, it's not just a wait-and-see situation. DIC can spiral fast, and you need medical attention immediately. Part 4. How do doctors diagnose DIC? Diagnosing DIC isn't as straightforward as running a single blood test. Doctors have to piece together the puzzle using a combination of your symptoms, your medical history, and specific lab tests. There's actually a scoring system to help doctors identify DIC. This includes platelet count, lower than normal suggests DIC. Prothrombin time, this shows how long your blood takes to clot. Levels of fibrin, a protein your body uses to make clots. Fibrinogen, this is converted into fibrin when you get injured, and its levels drop in DIC. Low platelets, low fibrinogen, and a longer than normal clotting time usually point to the second stage of DIC, where the bleeding becomes uncontrollable. And if the root cause of DIC isn't clear, like in cases where it's not linked to sepsis or trauma, doctors will run more tests to hunt for the underlying condition. Part 5, Treatment stopping the clotting and bleeding roller coaster. The million-dollar question, how do you treat DIC? There's no one-size-fits-all answer because the treatment depends heavily on what's causing the DIC in the first place. The first priority is controlling the clotting and bleeding. If you're in the clotting stage, doctors might give you blood thinners to prevent more dangerous clots from forming and damaging your organs. But once you hit the bleeding stage, the treatment flips. Now, you might need blood transfusions, whether it's plasma, platelets, or specific clotting factors. However, these are only given in cases where there's active bleeding. You're at a high risk of bleeding. You need to undergo surgery or another invasive procedure. Then, there's the root problem. Treating the underlying cause is key. This could mean antibiotics for sepsis, surgery to fix internal injuries, or early delivery for pregnancy-related complications. If the root cause is tackled quickly and effectively, there's a better chance to stop DIC from progressing. Part 6, the long-term outlook and potential complications. DIC isn't just a short-term issue. It can have long-lasting effects on your body, especially if it leads to organ damage. If it's not treated early, DIC can result in life-threatening complications like heart attacks or strokes, due to blocked arteries; gangrene, tissue death due to lack of blood; acute kidney failure; even multiple organ dysfunction syndrome, where several organs start to fail at once. Recovery is possible, but it's not always easy. The mortality rate for DIC is high, especially in people with sepsis or severe trauma. It can double the death rate in these patients. However, if the condition triggering DIC is reversible and treatment starts early, a full recovery is possible. But it takes time and, in many cases, a team of doctors from various specialties to monitor and manage the damage DIC has caused. Conclusion: stay informed, stay safe. DIC is a terrifying example of what happens when your body's delicate balance goes wrong. It's not something anyone expects to face, but knowing the symptoms, understanding the risks, and acting fast can make all the difference. While it's a serious and often life-threatening condition, early detection and treatment can improve the chances of survival. If you or someone you love ever experiences the warning signs of clotting or unexplained bleeding, don't wait, seek medical attention immediately. Your body's internal systems are intricate and fragile, and sometimes, they need a little help to keep everything in check. Stay informed. Stay safe. And remember, even in the scariest medical situations, knowledge is your best defense.